Hi, I'm Dr. Hoffmann. I'm chair of the Obstetrics and Gynecology Department here at Olmsted Medical Center. I'm also co-chair of the Women's Health Initiative. We're getting ready to see an expansion that's been years in the making. The plan is to develop a new Women's Health Pavilion, including a new birth center. Our goal is to meet the varied healthcare needs of women of all ages. Soon the landscape behind me is going to look very, very different. In a few minutes, we'll share some images of what you can expect this project to look like when it's complete. For now, we'll move to our current front entrance. Several years ago, our Obstetrics and Gynecology Department moved to this hospital site. We were soon followed by general surgery, plastics and bariatrics, as well as urology services. This arrangement allowed for better access to both staff and patients to our surgical services and our radiological services. This allows us to send expectant mothers to the birth center directly from the clinic, but bringing all these services together also created some problems. Our current lobby is too small, with too few waiting areas. As our patient numbers have grown, our lobby waiting areas haven't grown with them, and we need to make a better impression, as we have with our other new or renovated facilities at OMC. Access to the emergency room is not as convenient as it should be. The new expansion will create a contiguous pathway connecting the entire hospital to and from the emergency room. Our current OB/GYN clinic was moved here more than 10 years ago. While we're serving our patients well here, patient expectations are changing. They are expecting more from their healthcare experience. This facility is tired and needs upgrading. Also, we currently have a mixed patient population in our waiting area. Pregnant women and their families sit alongside patients with illnesses. We plan to provide more waiting room area options. Today, there are more requirements than ever for patient privacy, particularly in an area like plastic surgery. Our current spaces weren't built for the skill and expertise we have today at OMC. We also need to add more procedure rooms in our clinic for treatments we can do without hospitalizing patients or referring them elsewhere. Our goal is to create a women's health pavilion that provides more of the services women need when they need them in one location. These include obstetrics, gynecology, and preventative care, along with other health and wellness services, including psychology, psychiatry, breast health, bone density scanning, endocrinology, internal and family medicine, rehabilitation services, and physical therapy, orthopedic surgery, weight management, and bariatric surgery. We know having plastic surgery close to our OB/GYN department and general surgery areas is a positive for our patients. And our research has told us plastic surgery patients expect more in terms of privacy in the form of a separate entry. Providing all these services for women in one welcoming location will provide an exceptional and convenient experience. Now we're going to move up to our second floor. The second floor is where we did our last major improvements to the hospital campus, including our current joint replacement area, the medical surgical unit, our outpatient surgical unit, and our operating rooms. We are committed to ensuring these areas remain state-of-the-art and meet patient demand. I would like now to introduce you to Dr. Kim McKeon. She's a long-time OB/GYN physician, and she was elected by her peers to be on the OMC Board of Governors.
Thank you, Dr. Hoffmann. The Birth Center has been a hallmark of OMC's service to our region since 1987. That year, we implemented our Labor, Delivery, Recovery, Postpartum Model, or LDRP, providing all of a woman's delivery services in the same patient room. We're proud of this LDRP style and our one-to-one nursing care, using these concepts for the past 25 years. We are the only healthcare organization using this care model in southeastern Minnesota, a model that allows us to provide extraordinary care to our patients. One of life's most significant experiences is having a baby. At OMC, a mother-to-be is not moved along an assembly line, room to room. Her care team can stay with her throughout the whole delivery. Our current rooms are too small. We need more space for family members, support staff, and needed equipment. First, we'd like to improve the experience for our patients' families by providing a larger, improved lobby and waiting area outside the birth center. Within the birth center, we also need to provide better security for moms and their babies. Currently, babies wear security bands, but we need a locked unit for newborns and their families. Currently, our patient rooms all share bathrooms. On the new birth center, each room will have its own private bathroom, something essential for patient privacy and infection control. Each room will also have its own private soaking tub, rather than one tub for the entire unit. Nearly 1,000 babies are born in our birth center every year. The new birth center will improve that experience for every mother, child, and family member that spends time here in the years ahead. Our new birth center will add more rooms for mothers who've had C-sections or expectant mothers staying for observation. We have a dedicated C-section operating room, but having an operating room within the unit will be better for both the mother and the baby. Let's take a look at the path we need to take to get a patient to the OR for a C-section today. We start in one of these rooms, and we bring all our equipment down this hallway, through these doors, around this corner, and over. Despite this distance issue, we can still get a baby delivered by C-section in 20 minutes, but we can do better with an upgraded facility. In our planning, OMC staff has found ways to enhance patient care and the family's experience here in the birth center. Our new birth center will have 14 LDRP rooms and 6 C-section observation rooms, a dedicated C-section operating room on the floor, and we're bringing back a midwife program to meet patient preferences for prenatal care in uncomplicated pregnancies. Our new birth center will be welcoming for all, with extra space for spouses and support persons in the room, family waiting areas on the floor, and outside the birth center unit. We'll continue our prenatal education and lactation consulting in improved education spaces. We'll have an improved nursery with more space and separate private level 2 rooms for babies who need extra care. We've worked hard on our plans for the birth center and are excited to get moving on this expansion. Now I'll send it back downstairs to Dr. Hoffmann.
Now we'll give you a sneak peek at what some of the expansion will look like compared to what we've got in place here at Olmsted Medical Center's hospital today. Here's one of our hallways today. And here's a hallway that will connect our current facilities with our new ones. Here's our lobby today. Here's a rendering of what our lobby may look like. Here's our current waiting room that serves the entire hospital. Here's what our new family waiting room may look like. Here's one of our current delivery rooms. Here's what one of our new expanded delivery rooms may look like. Here's our exterior today. And here's what our new facility will look like. It's an exciting time here at Olmsted Medical Center. This expansion will help us serve our patients more thoughtfully, more strategically, more carefully. We're ready to go.